Every week, people come to me who have been walking consistently for months, 30 minutes a day, sometimes more, and they are still getting worse. Knee pain, chronic fatigue, numbness in the legs, stiffness that never fully goes away. The first question I ask every single one of them is the same: how exactly are you walking? Because the problem is almost never that people walk too little. The problem is that they walk wrong. And wrong walking does not just waste your time. It actively damages your joints. It overloads your cardiovascular system. It drives chronic inflammation through the very tissues you are trying to help. I am Dr. Robert Anderson, and today I am going to walk you through the 7 most common walking mistakes I see in patients over 50. Some of these will surprise you, and one of them is something almost nobody thinks about until it causes a serious injury. Mistake 1. Starting too fast. Your body is not a car. You cannot just step outside and immediately hit full pace. Your muscles are cold. Your synovial fluid has not yet spread evenly across your joint surfaces. Your cardiovascular system has not adjusted. Cold muscle fibers are less elastic. Less elasticity means higher risk of micro tears. Those are tiny rips in muscle tissue that individually cause no symptoms but accumulate over time into chronic pain. Meanwhile, your cartilage is running dry, and your heart is absorbing a sudden spike in demand that your blood vessels did not ask for. The fix takes 0 extra time. Spend the first 3 to 5 minutes of every walk moving slowly, deliberately slowly. That is your warm-up. After 5 minutes, your joints are lubricated, your muscles are warm, and your heart has found its rhythm. Now you can pick up the pace. Mistake 2. Poor posture while walking. An adult human head weighs about 11 pounds. When it sits directly over the spine, your neck carries exactly that load. When it shifts forward by just 1 to 2 inches, the load on your cervical spine multiplies 3 to 5 times. That means your neck and upper back are now holding 40 to 50 pounds continuously for the entire walk. This is why so many people come home from a walk with a stiff neck. It is not age, it is mechanics. And the second hit lands on your lungs. When your shoulders round forward, your diaphragm cannot fully descend. Your lungs cannot fully expand. You breathe shallow. Less oxygen reaches your muscles and your brain. You walk 30 minutes and feel like you walked an hour. Fix it by imagining a thread gently lifting the top of your head. Shoulders relaxed and slightly back. Eyes on the horizon, not the pavement. Chest open. In that position, your lungs work fully, your neck carries no excess load, and your spine distributes weight the way it was designed to. Mistake 3. The wrong shoes. After 52 things happen to your feet, the fat pads on the soles thin out. Those pads were your natural shock absorbers. Without them, every ground impact travels straight up the chain: ankle, knee, hip, lower back, and the arch of the foot can begin to collapse. That collapse changes the load angle on the knee, shifts the hip joint axis, and increases spinal stress with every step. You need adequate cushioning in both heel and forefoot. Arch support that follows the natural shape of your foot, and a sole that flexes at the ball of the foot so your heel-to-toe roll stays natural. Also, replace your walking shoes once a year, even if they look fine. The cushioning in the midsole loses its shock-absorbing properties long before the outer sole shows wear. This is not a shopping suggestion. This is osteoarthritis prevention. Mistake 4. One long walk instead of regular shorter ones. Your body does not respond to isolated bursts. It responds to repeated, consistent signals. Every time you walk, your body receives a message. Physical activity is the norm. In response, your heart becomes more efficient, your blood vessels adapt, your metabolism stays active. This process is called training adaptation, and it only happens with repetition. One long walk a week is too weak a signal. The body never fully adapts. And worse, a single long walk after several days of rest is a genuine stress event for unprepared muscles. They hurt afterward. People conclude that walking is not for them, but the joints are usually fine. The loading pattern is wrong. 20 to 30 minutes on most days of the week is the evidence-based minimum for cardiovascular benefit. If that feels like too much, start with 3 days a week and 10 minutes at a time. Add 5 minutes every 2 weeks. Gradual is sustainable. Mistake 5. Arms not moving. Walking is a whole body movement. When your left leg steps forward, your right arm naturally swings forward. This cross coordination is hardwired into your nervous system. It distributes load across your spine symmetrically and reduces the twisting force on your lower back with every step. When arms stay still, the spine compensates through over-rotation in the lumbar region. For anyone with existing lower back issues, this can be what triggers the pain. Arm swing also recruits your shoulders, chest, and upper back. More active muscle means better circulation, higher caloric expenditure, and a stronger metabolic signal from the same distance walked. Bend your elbows slightly, let them swing forward and back in natural rhythm opposite to your legs. That is all it takes. Mistake 6. Walking with your phone in your hand. When you look at a screen, your head tilts downward. We already covered what that does to your cervical spine. But there is a second problem that matters even more after 50. Your vestibular system and your proprioception, which is your body's sense of its own position in space, both gradually decline with age. Your brain increasingly relies on visual input to maintain balance while walking. When your eyes are on a screen instead of the path ahead, your brain is deprived of its most critical source of spatial information. You stop seeing uneven pavement, curbs, wet surfaces, sudden drops. A fall after 60 is not a minor inconvenience. It frequently means a fractured wrist, fractured ribs, or a hip fracture. A hip fracture at this age means surgery, extended immobilization, and months of rehabilitation. Phone goes in your pocket for the entire walk. Mistake 7. No recovery after walking. Muscle tissue is 70 to 75% water. Every process involved in muscle repair after exercise happens in an aqueous environment. Even mild dehydration measurably slows recovery and increases cramping risk. After every walk, drink a glass of water. During walking, your muscles contract repeatedly without fully lengthening. Afterward, they stay slightly shortened. Over time, they become tight and rigid. Joint range of motion decreases. 5 minutes of gentle stretching after every walk prevents this entirely. Focus on calves, hamstrings, and lower back, and take 1 to 2 rest days per week. Your body does not adapt during exercise. It adapts during recovery. Rest days are not weakness. They are when the actual benefit gets built in. Here is your complete action plan. Slow start for the first 3 to 5 minutes every single walk. Fix your posture before you step outside and maintain it. Check your shoes and replace them if they are over a year old. Walk 5 to 6 days a week for 20 to 30 minutes instead of one long session. Let your arms swing naturally. Phone in your pocket for the full walk. Water and 5 minutes of stretching after every walk without exception. These are not complicated changes, but the difference they make to your joints, your cardiovascular system, and your long-term mobility is not small. In the next video, I am going to show you what happens inside the knee joint specifically when these mistakes compound over years and the targeted exercises that reverse that damage before it becomes permanent. Subscribe so you do not miss it.